Hi, I'm Mike Kammermeyer. I'm coming to you from the ISUOG 2015. Here we're pleased to introduce the WS80A with Elite version 3. This year's improvement, like everything else, has been image quality, and I'll go through the ways how we've improved our overall image quality, plus features that can be useful clinically, including all the new 5D features that we're going to talk about. So first, image quality is always the most important thing. The WS80A with Elite is built on the S-Vision architecture. So it's a different kind of a beamforming with software and hardware combination to produce the best imaging. Along with that, we use our S-View transducers. These are very broad bandwidth transducers. These enable you to get the best resolution, but also great penetration. So you keep the resolution at depth. So it's a transducer with very large bandwidth. Again, so it can basically, you can use transducer for even your most challenging patients. On the version 3, we've introduced a total of 6 new transducers. So several for OB applications, and we've also expanded our applications on this product to general imaging and some cardiac applications as well. Along with that, multi-vision, clear vision, and we've also introduced the S-Harmonic. So all these ways to get the best 2D quality possible. And you need the best 2D to get the best kind of 3D imaging. So on top of our already existing 5D technologies, we now have 5D CNS Plus, which is built off of last year's 5D central nervous system. Previously we had 3 imaging planes. Now we have all 9 planes that are specific to ISUOG and AIUM guidelines. We've made improvements to 5D Heart. We now have 5D Heart with color, and we have introduced Crystal View. Crystal View, to me, is a totally new, unique rendering algorithm. This allows the user to see external borders of structures, as well as the internal structures that go along with it. It can be very helpful in obstetrics and gynecology. We've shown interesting examples in general imaging as well. So I can go through some examples. Again, this would be Crystal View. This is actually a twin pregnancy that was difficult to see the second fetus back behind there until you use the Crystal View. When we go to our regular algorithm, it's regular 3D, you can almost see Crystal View, just a single button. Again, shows through the entire volume, averaging intensities and gradient to highlight external and internal structures within the fetus. Again, with Crystal View, we start with our 3D rendering. This happens to be with Realistic View. Just to demonstrate the power, we're looking at the surface now. I simply press one button, Crystal View. We can still see the surface, but now we're seeing the internal structures. We can count the vertebrae, and we see the defect here, the neural tube defect, the spina bifida. So this is a great example. You can see it from the surface rendering. One button automatically shows it. Now you can see external and internal structures. We still have the capabilities to turn and rotate and evaluate the volume from any plane that we need. So this would be the advantage of Crystal View in combination with Realistic View. 5D CNS Plus. Again, this year we've added 6 additional planes. Previously we had the axial planes that would measure BPD, OFD, head circumference, cerebellum, and lateral ventricle. This technology is pretty amazing. I can simply hit the one button, 5D CNS. The system tells me where to mark, so I position my cursor between the thalamus, and I move my line through the cavum septum. I press one button. Now the machine will automatically evaluate the volume, turn it, rotate it, and demonstrate all 9 views, like I mentioned. Bang, there it is. So we have the mid-sagittal plane, showing the cavum septum pellucidity. We have our true BPD level, cavum septum all the way through. I can now tell the machine, just show me the axial planes. And with the axial planes, we see the transventricular view down here, transcerebellar view over here with the measurements of cerebellum and the posterior fossa. And we also get the transthalamic view that automatically measures the BPD, head circumference, and OFD. This was the previous version. Now we have added all of the coronal views to go along with this. So we see the frontal horns all the way through the cavum septum pellucidity, and then all the other coronal views all the way back to the posterior fossa. We've also now added the mid-sagittal planes or parasagittal planes showing the lateral ventricle in the mid-sagittal. All this from that 1 2-second volume acquisition through the BPD. We're very excited about 5D CNS Plus. This year on the WS80A with Elite version 3 is 5D limb volume. Now, limb volumes are going to be important as it adds additional precision to the estimation of the fetal weight. Currently, we measure biometry using the femur length. This says nothing about the soft tissue parameters of the fetus. So by using 5D limb volume, it can give us, again, a more precise estimation of the fetal weight, and it tells us more about the fetal well-being and fetal nutrition. So let me demonstrate this quickly. We do one sweep through either the thigh or the arm. It works on both. And I simply press 5D limb volume. I place my seed right in the middle of the bone. The machine now will measure the limb for me. I tell it it's a thigh, tell it to do it automatically. Place my 2 seed points in the axial plane. And the machine now will evaluate the volume, automatically trace the middle half of the limb, and it gives me a thigh volume automatically. This, what used to take manually anywhere from 2.5 to 3.5 minutes, can now be done within 10 or 15 seconds. So it makes this more usable in a clinical environment. In addition, our 5D heart, we've added similar steps, but now we can do the 5D heart acquisition with the color Doppler as well. The WS80A with Elite also is a very ergonomically designed system to meet your needs. You see very few buttons on the console, very simple system to use. In addition, we have a 23-inch LED screen. This can be turned side to side. You have excellent viewing capabilities from any angle. Again, the monitor can be lowered, can be folded flat for easy transport. In conclusion, we're pleased to introduce WS80A with Elite version 3, superb image quality, and improvements to all our 5D technologies. Ease of use, we also have included changes to workflow for ergonomics and measurements. So we hope you enjoy the new WS80A Elite.